Hello, this is Dr. Gay from First Take MRI, and this is a 72-year-old male with complaints of pain in the anterior elbow joint. He recently was lifting something and felt a pop and saw the orthopedic surgeon. They thought that he had a biceps tendon tear, and so he did an MRI of the elbow here to look at the biceps tendon, and indeed he has a problem here in the front. So I'm going to run through the anatomy of this pretty straightforward case. And here we go. This is the elbow joint here. This is the back of the elbow here. This is the olecranon process part of the ulna. This is the humerus here. This is the front. If we go above the elbow, kind of high up, now we're into the arm, and we see a muscle in the front here. This is the biceps muscle, and the little linear black line, that's the biceps tendon. The tendon is going to come together, the muscle is going to disappear, and that tendon is going to come down, 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 and form the biceps tendon that's more oval. Now in this view it looks pretty normal. There's a little bit of white fluid around it, not completely normal. And we get down a little bit further, it looks pretty good, but a little bit of fluid around it. And again, it's not nice and ovoid, it's a little flattened. And as we get down a little bit lower, we see lots of fluid. This is edema or hemorrhage surrounding the biceps tendon. And it's going to eventually attach down here on the radius. There's a bony protuberance called the radial tuberosity, and it's going to attach on that. So we're going to follow the biceps down. Here it looks really bad, very foggy and irregular. If we follow it down, there's a component here that looks like it just stopped. So there's a partial tear, little pieces hanging on down here. We're going to follow that piece down to the attachment. It looks really foggy. And then here it is. So that it attaches right along here, the biceps does. So most of it's torn. So this is maybe a 75% at least tear of the biceps tendon. The anterior component is completely torn. And then the posterior component here, our posterior component, is partially torn. There's a little piece hanging on there at the bottom. So a high-grade partial tear of the biceps tendon, very foggy, and there's edema or hemorrhage surrounding that in the antecubital fossa. We can see the same thing on a lateral view or side view here. We call this a sagittal view. Now we can see the ulna here. This is the triceps tendon attaching to the back. This is the humerus in front. And then here, or up, towards the front and up high, proximal. This is the brachialis muscle, this big muscle here, and over the top of it in the front, this is the biceps muscle. This is the central biceps tendon that's going to come down, down, down. And we see the biceps tendon stop here, part of it. And this is where it's partially torn. And here's a little component in the back there that goes down to attach. So small components hanging on, but most of it's torn. This is that edema and hemorrhage. This is just another orientation where we see the biceps here. This is a coronal view. And on this we see the biceps muscle belly up high. We see these dark bands, the tendons. The biceps, the word bi means two, so there's two components. This is the biceps short head, long head components. You watch them blend together to form the single biceps component here. And again, at the attachment, it's partially torn and poorly defined. And so in this case, they're going to have to repair if something is torn more than 50%. And especially in a case like this where it's more than 75%, they have to go in, remove the biceps tendon, even the component that's hanging on. They'll remove that, completely detach it, drill a little hole in there, and then put the biceps tendon in. It's usually a pretty strong anchor, and the patients do very well typically. So a high-grade partial tear of the biceps tendon that needs to be repaired in the 72-year-old male.